Hi, my name is Dr. Gallagher. I'm a plastic and reconstructive surgeon, and I do a lot of gender affirmation surgery, specifically vaginoplasty and procedures for trans feminine, trans masculine, non-binary folks. And in this video, I'm going to talk about a question I got recently over on TikTok, and that's whether the anatomy, whatever's going on down there before bottom surgery, influences the results after bottom surgery. And spoiler alert, it 100% does. So the thing you have to know is you'll see a lot of variation in results even from the same surgeon. I have plenty of results over on my website, www.gallagherplasticsurgery.com, where you can take a look through the gallery and see, well, they look very different, and that's because the genitalia oftentimes looks very different before surgery. So the question I get most commonly is whether there's going to be enough tissue down there. If the anatomy is very small to begin with, are we going to be able to do vaginoplasty? And I would say in the vast majority of cases, I find that that is not a problem and we're able to proceed just fine. And because we have smaller anatomy down there, it means post-operatively we're probably going to get smaller labia, majora, minora, and that sort of thing. However, there is a group of patients that is the exception, and that's folks who have maybe on blockers, they've been on blockers during puberty and then therefore it never fully developed. And in those patients, oftentimes we may steer them towards a different type of technique as opposed to the penile inversion technique, such as the peritoneal technique, where we're using some tissue from inside the belly to line the new vagina, and therefore not so much relying on the external genitalia to create the new anatomy. I've mentioned it before in previous videos that if a patient has had the testicles removed before bottom surgery with an orchiectomy done previously, this is, in my experience, absolutely not going to interfere with bottom surgery ultimately. So there's a few different ways, subtle ways that the appearances can be affected. Most of the time there's enough tissue, and if you see enough before and after results, you see a lot of variation, even from the same surgeon. Check out the website, and thank you for listening.